Hey everybody, this is the Metformin group. I'm Mariah.
I'm Brenda.
I'm Jesse.
I'm Beverly.
And I'm Claudia.
Okay, so here's the situation. The patient came in for his annual checkup and explained that he has been experiencing increased thirst and hunger. He also reports urinating more frequently and also reported feeling tired and even having blurred vision at times. His blood glucose level was 212, which indicates hyperglycemia. His primary care provider collected blood for the lab and found that the patient's A1C level was 9.2. Here is some background information on our patient. He's a 45-year-old Hispanic male with no known allergies living in Fresno, California. The patient was originally diagnosed with diabetes in July of 2015. A few years later, in 2021, it was found that his diabetes was not being well managed. The patient's diet and exercise habits have not improved, and the current treatment plan hasn't been as effective as hoped. His primary care provider decided to start the patient on a medication called Metformin in December of 2021.
In the initial assessment done on the patient, his vital signs were found to be within normal limits. His diet consisted of eating out 4 to 5 times a week. His BMI was a 35, which indicated obesity. The patient was 5'11" and weighed 250 pounds. Exercise-wise, the patient had an office job where he sat frequently, and he did not exercise regularly. As for the recommendations, the patient should take his metformin as prescribed by provider and follow a healthy diet and exercise regimen. Blood glucose levels should be taken frequently, and hemoglobin A1C should be taken every 3 months until stabilized. And now an overview for the patient using ADPI. So with a thorough assessment, we were able to find that the patient had type 2 diabetes since 2015 and is currently feeling symptoms of weakness and blurred vision. The patient also reports to have excessive hunger and thirst and claims to eat out frequently and have a sedentary lifestyle. For the diagnosis, the patient has ineffective therapeutic regimen management related to diabetes mellitus as evidenced by blood glucose level of 212 and an A1C of 9.2. For planning, the patient will see a reduction of blood glucose level to a reference range of 80 to 130. This reference range is specific to patients with type 2 diabetes. For implement, the patient will now take metformin in hopes of being able to control blood sugar levels. The patient will eat more healthy and exercise. The patient will take 500 milligrams 2 times a day, taking it with the morning and evening meals, or 850 milligrams a day, taking with the morning meal. For evaluation, the patient will have follow-up appointments in order to see if the metformin is helping keep his blood sugar levels controlled.
So a little bit more about metformin. Generic name is metformin or metformin XR. Some brand names include Glucophage, Glucophage XR, Glumetza or Riomet. Drug classification is biguanides. PLLR, or also known as pregnancy and lactation labeling rule. Only take metformin if prescribed by the primary care provider. And metformin appears in human milk, therefore patients should not breastfeed while taking metformin, or they could discontinue taking metformin if they decide to continue breastfeeding. And the mechanism of action for metformin is it reduces glucose levels by reducing gluconeogenesis, thus suppressing hepatic production of glucose. So with metformin, it can be taken via the PO route or by mouth, and it comes with 3 different forms, which include the immediate release tablet, liquid solution, and extended release tablet. With immediate release tablet, the initial dosing, a patient could be prescribed with 500 mg PO every 12 hours. So with this, a patient could take 500 mg PO with morning meals and 500 mg PO with evening meals. Or the patient could take 850 mg PO every day with meals. And for the maintenance dose, a patient could take 1500 to 2500 mg per day PO divided every 8 to 12 hours with meals. And the maximum dose for maintenance is 2550 mg per day. The peak for immediate release tablet is in between 2 to 3 hours. And for the liquid solution, it comes with 5 ml twice a day or 8.5 ml once a day with meals. The provider may increase the dosing until the blood sugar level is controlled, but the maximum dose that a patient could take with liquid solution is 25.5 ml per day. And the peak for this form is 2.5 hours. And lastly, with extended release tablet, it comes with 500 mg PO every day with dinner, titrate by 500 mg per day every week, and the maximum dose is 2000 mg per day. And the peak for extended release tablet is between 4 to 8 hours. So for all forms, there's no known duration or onset found, and the half-life for all forms is in between 4 to 9 hours. Some indications of metformin and as to why a patient is prescribed with this medication is it is an adjunctive therapy to diet and exercise to improve glycemic control to those with type 2 diabetes mellitus. So this medication works best with diet and exercise. It is also used as a prevention of type 2 diabetes to those who are pre-diabetic patients. For example, those with impaired glucose tolerance, impaired fasting glucose, or HA1C of 5.7% to 6.4%. However, this medication should not be given under some circumstances, such as patients with renal dysfunction, disease, failure, or impairment. Radiographic contrast and administration, such as patients who are gonna undergo some diagnostic tests, such as MRI with contrast or CT with contrast. Type 1 diabetes mellitus or diabetic ketoacidosis, hepatic or cardiopulmonary insufficiency, metabolic or lactic acidosis, concurrent infections, sepsis, surgery, or lactation.
Next, I'll be talking about the pharmacokinetics, the pharmacodynamics, and pharmacogenomics of metformin. To start off, we're going to be talking about the pharmacokinetics. So, metformin is not metabolized in the kidney or liver. It is absorbed in the intestine and distributed through the bloodstream to target tissues and proximal tubule cells and excreted through the urine. Metformin has a half-life of 4 hours, and 50% of the dose is absorbed into the systematic circulation. As for the pharmacodynamics of metformin, its mechanism of action is that it inhibits hepatic glucose production and increases sensitivity of peripheral tissue to insulin. Lastly, for pharmacogenomics, there has been findings that show interactions between cells expressing variants of OCT1 in which metformin uptake is reduced, MATE1 which causes a higher metformin levels in hepatocytes, and C allele of RS2252281 which shows a significantly better glucose-lowering response to metformin. As for the response to the drug, so again, metformin decreases hepatic glucose production absorption and also increased sensitivity to insulin by increasing glucose utilization and uptake. Within elder patients, it is noted that there is a decreased response to metformin compared to healthy individuals. And lastly, metformin can also cause psychological reactions like anxiety, depression, sleepiness, difficulty concentrating, and nervousness. As for socioeconomics, metformin is cheaper than insulin, but is still pretty expensive. However, healthcare insurance will help decrease the price to make it more affordable for patients. As for cultural, diet has been a big role in the effectiveness of metformin, so it is best to educate the patient about lifestyle changes. Lastly, for spiritual, some patients may have some distrust in pharmacology from personal negative experiences, so it's best to educate the patient how the benefits outweighs the risk.
Moving forward with health inequities, it has been found that in regards to age, older adults have a decreased total plasma clearance, prolonged half-life, and increased Cmax. In regards to gender, it has been found that females have a higher Cmax for metformin when compared to males, but this difference isn't significant enough to overall state that there's a significant difference between females and males who are taking metformin. In regards to race, it has been found that there's a difference between pharmacodynamics between African Americans and Caucasians. African Americans appear to have a better glycemic response to metformin when compared to Caucasians. And with ethnicity, there's no definitive difference between ethnic groups, but data does suggest that there is a higher Cmax amongst the Asian community. So we're going to want to monitor the patient to make sure that we're seeing the therapeutic effects of his new regimen.
And by doing this, we're going to instruct the patient to perform daily blood glucose testing to make sure that his blood glucose levels aren't too low but aren't too high either. We're also going to reschedule the patient in about 3 months to check those A1C levels. As we noted, the A1C levels when he came into the clinic was around 9%, which is really high. So we expect to see that in 3 months, those A1C levels are going to reduce. We're also going to refer the patient to a dietitian to make sure that he's incorporating specific food groups into his diet, and then also limiting some food groups. We did note that the patient does like to eat out a lot, so maybe we can provide some resources to help reduce the outside eating, maybe like meal prepping and such. And then lastly, we're going to encourage the patient to reduce his BMI. His BMI is currently at a 35, which is indicating obesity. So we want to encourage the patient to reduce his BMI to help manage the diabetes. So this slide goes over a lot of the legal information. As nurses, of course, it's important that we assess our patient to monitor for improvements, changes, and report any abnormalities to the provider. It's also in our scope of practice to provide patient education, which we are going to do with our patient in just a few minutes. It's important to inform the patient how to take this drug, what this drug is used for, how this drug works, any side effects, any adverse effects to report to the provider, how to take the drug, and just a lot of information about the frequently asked questions that a patient would have about a certain medication. It's also important to note that metformin should not be taken in a hospital setting due to risk of acute kidney injury. So it's important to let the patient know that if they were to be hospitalized, of course, make sure that they inform the provider that they are taking metformin. And then another thing that's important to note is that there is a black box warning for patients with lactic acidosis.
Good morning, Mr. Salvador. How are you doing today?
I'm doing good. How are you?
Good. Okay, so my name is Brenda, and I'm your nurse, and I'm just going to go ahead and go over some medication information, a little patient teaching for you to know how to take it and what you're doing, okay? So do you know what medication you're taking home?
Isn't it the metformin?
Awesome. And do you know what it's used for?
I think it's for my diabetes, correct?
Yes, you're correct. So metformin is usually given to patients, with type 2 diabetes, and this will just help lower your blood sugar levels. And along with this, your muscles are going to be absorbing that, so your blood sugar levels will go down, okay? So it's just to help manage it. So with every medication, there is some side effects, and I know it might sound a little bit overwhelming, but don't worry, it's expected from them. So don't get too alarmed if you feel like any stomach pain, diarrhea, vomiting. Those are just some of the things, along with a headache or feeling weak. So these are just side effects that you could go ahead and have, but like I said, don't feel too overwhelmed or alarmed, because overall these medications are helping lower your blood sugar, okay? So if you by any chance happen to have any allergic reaction, which could have like redness, hives, itchiness, you could have trouble breathing, those type of things, make sure to contact your provider immediately, because you're going to be having an allergic reaction, and we want to make sure we have you attended as soon as possible, okay? Along with that, stomach issues are usually common beginning metformin, but if it doesn't decrease over time, make sure to tell your provider so we could go ahead and see what's going on. There could be further things going on in the body or interactions, so we want to make sure we go ahead and catch those in time, okay? And then, of course, since this medication is used to lower your blood sugar levels, it could probably get a little bit too low, okay? So we have to look out for symptoms of that, which could be like a little bit of sweating, you could have a little shaking, confusion, you're going to have a very fast heartbeat. So those are all symptoms of having very low blood sugar, okay? So along with this medication, we have to look at the possibility of interactions. So if you're taking other medications or even supplements, make sure you tell your provider beforehand, okay? A lot of the times these medications could interact with your new medication, and it could cause some very unwanted side effects or things, okay? And then along with this, just go ahead and let your provider know if you're allergic to anything, any of the medications, if you by any chance have any liver problems, heart problems, because we want to make sure we're giving you a medication that's going to help you and not cause more problems, okay? And then it's very important that you realize that these dosages should not be taken lightly. So you have to make sure you take these medications every day around the same time. If I were you, you could do like an alarm clock or something just to make sure every day you have it around the same time. And then go ahead and make sure that if you skip a dose, you do not try to replace that dose. So if you happen to skip a dose, just forget about it and continue with your regular dosages or routine. We want to make sure you don't have an overdose with all this medication. So it's okay, ignore it. Just make sure it's not something that happens all the time. And by any chance you skip many doses, just tell your provider for we can see what we can do to make sure you're constantly taking these medications at the given time, okay? And then make sure when you store it in a dry place and it's room temperature. Keep it away from children and animals. We want to make sure they are away from that. Do not take any medication that might be expired or some old medication that you haven't finished. Just make sure you throw it away. So that's very important, along with keeping it away from the sunlight, okay? I know this is so much information, so we're going to go ahead and give you a brochure before you leave home, just that way you can have these at home and know what to look for and what to do in case you happen to have an interaction or any more questions, okay? So just to make sure you got the concept of it, I'm going to go ahead and ask you some questions. So can you tell me what you should do if you happen to miss a dose?
I'm just gonna skip that dose entirely and just continue on with my next dose.
Okay,
just
awesome.
don't double dose.
Correct. How would you store your medication?
We would store it in a dry place and keep it away from women, keep it away from children and animals.
Okay, awesome. And what is some side effects or allergic reaction things you have to look for?
So like allergic reactions like hives, redness, all those stuff. We also want to make sure that I don't get hypoglycemic because it does lower my blood sugar. And also like stomach issues. Those are
Okay, awesome. Okay, it seems like you're doing really good. Like I said, we are going to send you home today with a pamphlet just to give you a little bit more information so you can have it on hand, okay? And do you have any questions?
No.
No? Okay. Well, it was really nice meeting you, Mr. Salvador, and hopefully we get your blood sugar levels fixed, okay?
Okay.
All right.
This slide presents the brochure used by the nurse in the patient teaching video. This brochure provides information regarding the medication Metformin. And this concludes our presentation. Thank you guys for listening. Is there any questions?